According to CancerConnect.com, more than 11,000 women are diagnosed with cervical cancer each year in the United States alone. Close to 4,000 of those women die of the disease annually. Worldwide, an estimated 310,000 women die of cervical cancer each year. And in some developing nations, cervical cancer is the leading cause of death among women. The leading cause of death. But there's something that can be done about this. Joining me this morning is Dr. Jennifer Smith, Associate Professor of Research in the Department of Epidemiology at the University of North Carolina, Chapel Hill. She's here as part of our Hear Us Roar Healthy Living Corner, a partnership we share with Women Magazine. Good morning, Doctor.
It's really a pleasure to be here.
I'm glad you're here.
No, it's incredible because I think all of these 4,000 cases that we have in the United States are nearly virtually able to be eliminated.
And let's talk about that. First of all, one of the well-known causes of cervical cancer is a virus, right? Tell us more about it.
Well, what people don't know is there are viruses that actually can cause cancer. Human papillomavirus, or HPV, is the main cause of cervical cancer. There are specific types that cause cervical cancer, primarily types 16 and 18, and other HPV types can cause genital warts. What people also don't know is that HPV infection can not only, it's a primary cause, almost 100% of cervical cancer cases are caused by HPV. But HPV can also cause anal cancer, as well as oropharyngeal cancer in men and women, vaginal and vulvar cancer in females, and also penile cancer in men.
Now let me ask you something. Explain to me how someone can be exposed to HPV or maybe contract it.
Okay, well, what's really interesting about HPV, unlike a lot of other sexually transmitted infections, is HPV is very common. So the main way of acquiring HPV infection is that it's sexually transmitted.
Okay.
But most people actually acquire HPV infection. So the estimates are about 80% of individuals will acquire an HPV infection over their lifetime. So it's extremely common, yet most of the infections are actually self-limiting. They actually clear.
Okay, but the good news here, and there's good news, is that something can be done about it, right?
Oh, yes, and that's actually what has led to, I think, the revolution for cervical cancer prevention. There are now 2 vaccines that prevent specific types of HPV that are actually on the market in the United States. And these vaccines both actually provide protection against types 16 and 18, and they're actually being recommended now for universal vaccination of young female adolescents 11 to 12, down to 9 and up to 26 age group is also recommended. And there's also a recent recommendation, approval of vaccination for young boys.
Okay, so again, the age is around 11 or 12.
The ideal age to vaccinate is 11 to 12, and that's because HPV is very quickly transmitted after sexual intercourse. So it's really best to actually provide vaccine before first sexual encounter. And a lot of women ask me, well, why vaccinate my daughter? And I think given the number of vaccine doses and the safety, my question back is why wouldn't you?
Why not?
Yes.
Right. So, doctor, we shouldn't only just think about vaccines, but the bottom line, screenings and treatments, right?
Yeah, and this is actually a really critical point, and I'm glad that you brought it up, because HPV vaccines have a promise to reduce roughly 70% of invasive cancer risk in the future for women who are vaccinated. But the issue is that the vaccines, current generation vaccines, do not cover all the types that actually cause invasive cancer. So continuation of screening programs is critical. But furthermore, I think it's really important that we all know that even if you have no insurance or you're underinsured, there is a place for you to go and get screened. Please contact your state health department. Please contact your state breast and cervical cancer screening programs to know more about how you can get screened. And also, if you're uninsured or have no insurance, please contact your Vaccines for Children program in order to provide vaccine for your children.
The bottom line, there's really no excuse here. We can prevent this if we take all the measures necessary, which you just gave us.
And so let's do more, because we can.
And I agree with you, too. Now, let me ask you something. I was reading here about you, and I understand that UNC is involved in the Cancer-Free America Initiative. Can you tell me a little bit more about that?
Yes, we're really actually, it's coming back to the issue that you raised in the beginning of the session, that there are 4,000 women who are dying, we believe, unnecessarily of a preventable cancer.
Right.
And so Cervical Cancer-Free America is really moving the dialogue broader and moving it down to the state level. So we're working with cervical cancer survivors. We want to engage mothers, their daughters, any community members, our friends and family, public health stakeholders, and we're developing coalitions on the state level to actually try to address how can we increase vaccination coverage of young female adolescents? How can we also increase screening coverage among women who've not been screened regularly, and how could we ensure continuity to treatment? Because I think ultimately we can make a real difference to end this cancer.
Absolutely.
And we can virtually end it by working together. And I think it really is women uniting with their partners, their family members, and we're trying to prevent a preventable cancer among women and their daughters. These are our friends, our sisters, our grandmothers, our mothers.
Thank you so much,
Thank you.
Doctor. I really appreciate it, and your passion as well. For more information or to get involved, check out the website, cervicalcancerfreeamerica.org. And as always, you can also go to cancerconnect.com.